One eye is bigger than the other. Wanted to ask if this is normal. One eye appears to be significantly smaller than the other. I think it's the upper eyelid of my right eye that appears swollen. However, it doesn't feel swollen. Any advice on what it is? I have heard of silent sinus syndrome. What treatment should I receive?
Thank you for your question. You submitted a single photo and you stated in your question about your concern about one eye looking much larger than the other or one eye actually looking smaller than the other. You're asking, is this normal? And you mentioned in your question about the silent sinus syndrome, and you want to know what kind of treatment you need. Well, I can certainly give you some guidance as to what you should do moving forward based on the single photo and a kind of a very broad question. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And the asymmetric appearance of eyes is something I deal with a lot. Very often it's because one eyelid is droopy compared to the other, as well as one eye being too open compared to the other. So we'll get into some terminology here, and I'm just going to give you my opinion based on just my initial examination of your photo. So to me, when I look at your photo, your left eye looks considerably more open than your right eye. And the medical term for that is called eyelid retraction. Now, eyelid retraction basically means that the eyelid is more elevated or pulled open. So you can have upper eyelid retraction, you can have lower eyelid retraction, you can have both. Now, since there's no side view, the question also is whether or not that eye is more prominent or whether it's pushed forward. That terminology is called proptosis. Now, understanding that, the question now is this something you've always had? There are situations where people are born with congenital eyelid retraction, and it's not very common, but I've taken care of patients and I've performed surgery to lower the eyelid of someone who was born with a retracted eyelid, and it's always been like that. So my suggestion is review previous photos. See if it's always been like this. See if this was present when you were a child. Now, another issue that needs to be addressed is the most common cause of acquired eyelid retraction, and that brings us to an area called thyroid eye disease. Thyroid eye disease is often referred to by the name of a famous doctor. It's called Graves' disease. Now, what this means is that there is a certain type of antibody called thyroid, and we refer to the whole syndrome as thyroid-related immune orbitopathy. It's a mouthful. But the point is that when it comes to a new onset of eyelid retraction, pretty much every doctor you meet will ask you about your thyroid. And so it's very important that you pursue a medical workup. Asking how do you treat this, and you're doing research and you came up with the silent sinus syndrome, it is very difficult for you to self-diagnose and prescribe. But as far as guidance is concerned, I would say that if this is acquired, it's new, it's not, you aren't born with this, you need to have a good medical workup, because thyroid-related eye disease is something I've done a lot of work with. And I have done a lot of surgery for, everything from procedures like orbital decompression and eyelid retraction surgery to help normalize the eyes. But we're getting ahead of ourselves, because the first line of treatment is not eyelid surgery. It's actually about the medical management of the thyroid-related immune orbitopathy, if this is the situation for you. So again, in summary, distinguish whether or not you've always had this appearance. And if you've had a medical workup and there's no evidence of any abnormalities, that, or I should say that your endocrinologist or medical doctor feels comfortable with the diagnosis not being thyroid eye disease, well, then there are surgical options that you can consider. But if this is acquired, then this is just the beginning of a journey. So I highly recommend you meet with your medical doctor, meet with an ophthalmologist, get some opinions about what is causing this asymmetry, especially if it's recently changed or acquired, and move forward from that point on. So I hope that was helpful. I wish you the best of luck, and thank you for your question.